I'd just like to say how very, very deeply proud and touched I am to be given this award. I have the most immense admiration and respect for the people that I work with at WMI. I had the great privilege of doing my postdoctoral research with Cesar Milstein, who was awarded the Nobel Prize for his discovery of monoclonal antibodies. And those reagents, just by themselves, have completely transformed medicine, not only in diagnostics, but in treatment. Think of a drug like trastuzumab, known commonly as Herceptin, which alone caused a 50% improvement in outcome for patients with HER2-positive breast cancer. So there's a classic example, but there are literally thousands of them. Really fantastic and thrilling stories. They've taken 25 years to roll out, but we're now seeing an exponential increase in the speed with which new knowledge is taken into the clinic. For 27 years, I worked in melanoma without any effective treatment for metastatic disease, and trying one clinical trial after another, banging our heads against the wall. And suddenly, in the last 3 to 4 years, we've come along with not one but two different strands of attack which really work for this disease. The unique thing that we made in the targeted drug field, the unique discovery the Westmead team made, was the discovery that these drugs work in the brain. That was not predicted. It was not predicted by the design of the drugs. And the involvement of the brain in melanoma is a dreadful problem that contributes to death in the majority of patients. So together with Georgina Long, we were able to make that discovery at Westmead and carry it through into the largest clinical trial ever conducted in brain metastases, and really changed the paradigm for treating that aspect of the disease. I guess the thing I'm actually proudest of anything, is the fact that we've had such an amazingly stable team in all areas that I work in at Westmead. So in the laboratory in Wicker, I work with people that I've worked with since I was a student. People who want to test out drugs look for solid, productive, stable teams who can deliver. And we've sure done that. And I'm immensely proud of whatever small role I've played in keeping that whole team together. This is a fantastic institution. It's got many, many unique features. It's one of the few medical research institutes in Australia that's tightly integrated with a teaching hospital, where you've got the same leading clinical investigators walking the corridors of a major and wonderful new institute now with a fantastic building, the same people who are walking the wards. There's no better or more inspiring environment for the best form of translational medical research.